As a Chief Nursing Officer and the Deputy Chief Executive at CWPT, I really think PCREF is so important, not just to me, to the organization, but to our local communities. I think this is once in a lifetime opportunity. If we don't get it right in terms of implementing this framework at speed, we are doing a disservice to our community. We know that for years and years and years, people from racialized and ethnically diverse communities who try and access our services don't always get the best experience or the best outcomes in care. Some of that is due to the stigma surrounding mental illness, which means then that people don't access services in a timely way. And when they do, sometimes it's late and they're having to come in contact with our services during a crisis. That's really, really difficult and traumatizing. So I'm really excited about the opportunity that PCREF brings, because I think if we can work well with our local communities and really collaborate on the work that we need to do to build that trust and that confidence in us as a provider, main provider of mental health services, will go a significant way in improving the experiences and the outcomes for people. I mean, I remember when I started as a student nurse back in the early 90s and hearing some of the issues around high use of detentions, people being given high doses of medication, not having the ability to access especially psychological therapies. That was really difficult to hear. We've moved some way, but I don't think we've moved significantly enough. I appreciate that as members of staff, we've got our workforce race equality framework as a framework that gets us to think about how we can integrate and work in a different way with our staff, recognizing those disparities that exist. So I think PCREF brings that opportunity for us to be able to work with patients, with our carers and our local communities in a different way. I really think that is going to make a difference to people's experiences. Thinking about how, what might people notice and start to experience as a result of doing this, and if we do it really well. I would be hoping that when we look at our data that we collect in the organization and we start to analyze it in terms of those differences in terms of ethnicity, we'll start to see people accessing services, people giving their voice to the experience that they have in a way that at the moment we are not able to do that. I would really invite you to get involved and to get engaged with this work. I know that as CWPT, we can't do it on our own. In fact, it really needs to be led by our local communities, and we as an organization supporting that way of working. It can't be a CWPT-led thing. It needs to be absolutely done jointly with people who use our services and their nearest and dearest, and then of course the local communities in which they reside and draw on and work with for support. You would have heard, I think a few months ago, that we started focusing on ethnicity recording. This is really important. Let's keep it going. We're monitoring that at a trust-wide level, and we've already seen some significant improvements, particularly in our Children's Directorate, and I know the other directorates are working on that. Why recording ethnicity is really important. Part of the work that we need to do is understanding our data. And so we collect lots of data, as you probably know, right from people's experience, from incidents, from people who are accessing services. If we are missing information on understanding who we are serving, there's no point building any other plans, because actually we don't know who we are looking after. We don't know who is not accessing services, who should otherwise be doing that. So data is really, really important. As I said, ethnicity recording is the priority that we've made, that we want to focus on in the coming year. And then everything else will come out of that. So you would be aware, you're all working really hard in seeking people's feedback on the experience of using our services through I Want Great Care as an example. Can you imagine what it would be like when we work out what is the population breakdown in terms of ethnicity within Coventry and Warwickshire, map it against our I1 grade care feedback? We can easily see then where we are not hearing from different parts of our communities, and then we can really use our time and effort to work with those individuals to make sure that their voice is being heard and that we can monitor their outcomes. Ultimately, people are accessing services in order to get a good experience and to get good clinical outcomes from there. So I'm really hoping that you will get involved, get energized as much as I've done with wanting to lead this. And I take absolute personal responsibility in my leadership role to make sure that we get this right for our communities. It's not going to be a quick fix. It's not going to be a tick box exercise. We know that changing culture takes a long time, and we are absolutely committed to getting it right for our local people. At the heart of PCREF is an anti-racist approach. This is so important for our communities and for people who may not have trust in our sorts of services. We've got a unique opportunity here as the main provider of mental health services across Coventry and Warwickshire to really collaborate and do something different with people who may want to use our services or who are using services at the moment. I really want to reassure you that we are absolutely committed as an organization to listen to you, to work with you, to rebuild that trust that I know may be lost. I really want you to have that confidence that when we say we'll work together to put things right, we are determined to do it, and that we will do it and we'll see it through. I know we're not going to be able to do it on our own, and there's no way we can do this on our own, because in order to tackle the sort of challenges that we've got and we know have existed over decades, it's not something that one organization can do. And I know we've got we've got some really good relationships locally, and I would really want us to build on that in order to make the experience and outcomes for people from minoritized communities much better and as good as they could be for anyone who is using our services. So I really invite you to come forward and work with us. If you want to get involved, please contact me directly, and I'll put you in touch with other people who we are working with as part of this work. Thank you.